Hello, John. I'm glad you came back. We're going to be going over your x-rays real quick, especially so that way we can help you out with your low back pain. So, last time you came in, you were telling me you were dealing with low back pain that's been going on for about a year. After doing the x-rays, I think we have a good idea of what's going on and how we can help. All right, so I want to go over these x-rays with you real quick. And then afterwards, if you have any questions, just let me know. But first, I want to explain to you exactly what it is we're looking at. So when we're looking at the x-ray, we're looking at the bones within your vertebra, bones within your spine. And what we're seeing is everything aligned properly? Are there any fractures, anything that we may need to be aware of, or that could potentially be contributing to your pain? And what we're finding on these x-rays is, as far as your disc space, which sometimes can decrease as we age, you actually look really good. The disc space between each bone looks pretty good, especially for your age and what it is that you're doing. But there are a couple things, nothing to be too alarmed over, that I do want you to be aware of. If you look over here, you'll see a little bit of whitening at the bottom and even a little bit at the top and edges of that bone. That could be due to degeneration, that could be due to aging, but I just want you to be aware that when you see this, this is just a little bit of buildup of bone that's trying to protect, because over time and over age, we start to degenerate, we lose a little bit of elasticity within the spine, especially our discs, right, in between each bone. So if you're seeing that, it could just be something that you want to take note of, but it's nothing that I want you to be too alarmed about, okay? But there are some things that also show up very similar to this that shouldn't be there. And I do want you to take note of this. You see how here, this is a little bit wider and brighter than other areas of the bone? That's because of that buildup of bone or that buildup of calcium. This can happen due to degeneration, it can happen due to trauma. And when we see this in areas that we know it shouldn't be, say in the middle of the bone versus the edges, this could also show us that there might have been some type of fracture in the past, or could be a fracture presently. And when we're looking at your spine, right over here on the edges of that vertebrae, we're seeing some of those white lines. And I think this has a big deal to do with your back pain. When we're looking at the spine, you'll see right here, one bone is aligned with the other. And then out of nowhere, it just starts to come forward. What I'm seeing here is a slippage of one of your bones, and that's called anterior spondylolisthesis. It's a big scientific word, but the main thing that I want you to be aware of is that the bones are supposed to be aligned perfectly on top of each other. And when one starts to push forward, it creates a lot of pressure, not only on it, but on the surrounding structures around it, nerves, blood vessels, muscles, and tissue. And this could be a big reason why you're feeling a lot of the pain that you're feeling, okay? So I want you to be aware of that. Luckily though, it doesn't seem like it's too big of an issue that we wouldn't be able to treat in office, but I do want you to be aware of this could be why you're feeling those pains, why you're feeling a little bit of that referring pain down the body, as well as the back pain over this specific spot, okay? I know you've been dealing with this for about a year, and the way I'm looking at this, it looks like we do have some buildup, right? And the way I want you to think about it is plaque on the bones, right? When we as doctors are seeing this plaque on the bones, it's giving us some type of hint to say that something may need further attention. And when I see it right here on the edges where they're not supposed to be, that's giving me a lot of attention to say, I think that what we're dealing with right now is a slippage of the bone on top of each other, which is causing a lot of the symptoms that you're dealing with. We'll be able to take care of that. We'll be able to help you out, okay? Everything else looks really good. Disc space as well. Degeneration, that's to be expected, but the main issue that we want to help you with is that slippage of the bone on top of each other. Any questions that you might have, please let me know, okay?